So your PSA is elevated. What did the European Association of Urology guidelines say about what to do next? If your PSA is between 2 and 10, and you've been to your urologist and he's excluded an infection and he has examined you and he doesn't feel a tumor, there's a few things which are guidelines recommended at this point. The first one is using a risk calculator. A risk calculator is an application on your phone or on an iPad into which you enter the clinical data such as your age, your prostate volume, your PSA level, and other factors, which generate a risk value of detecting prostate cancer if a biopsy would be done to you. Now, another way of assessing your risk of detecting prostate cancer based on an elevated PSA is performing a multiparametric prostate MRI. The current guidelines recommend PIRADS reporting. And we're in Nijmegen right now. That's where PIRADS came from. So you want to consider and discuss with your urologist about a prostate MRI, whether or not it's going to change the next steps. And it may change the way a biopsy is done. The final recommendation of the EAU guidelines is using biomarkers, thinking about using biomarkers. It's 4K score, it's Select MDX, it's PCA3 or PHI. All four of these blood-based and urine-based biomarkers are meant to assess the risk of detecting prostate cancer if a biopsy would be done. Now, what are we achieving by this? We're decreasing the risk of biopsying men who will not benefit